Thank you. I am going today to briefly introduce what the empowered aid is and introduce a little bit our participatory approaches that we use to mitigate the SCA risks throughout the empowered aid process. But a brief overview of who we are and what the Global Women's Institute is. The Global Women's Institute specialized in research on violence against women and girls and gender equality, uses rigorous and participatory research methods to create a knowledge base to inform programming in humanitarian and development contexts. Our aim is to produce a strong knowledge really to address a variety of issues that are affecting women and girls by, as I said, bringing participatory rigorous methods to work with partners in these settings. A general overview about what empowered aid is. As you can see, our main question and our main idea behind empowered aid is to answer the question on how might the ways we deliver humanitarian aid increase risks of SCA within the affected populations. And we know that there were a lot of meaningful processes that have been made in addressing SCA in humanitarian settings since its magnitude first came to light in 2002. Yet there is still a lot that is remained to be done. So really efforts to mitigate these SCA risks require better engaging local communities and understanding from them how aid actors can improve their programming and reduce these risks that are associated with SCA as well as other forms of gender-based violence. So what empowered aid does is that it provided rigorous participatory research on the ways in which aid distributions can increase SCA risks and how to better mitigate them in partnership and working with the refugee women and girls and in their communities in the research locations we first started with. So together with the Global Women's Institute and operational partner agencies, members of the affected population guided the identification and prioritization of ways to improve the modalities that are used for distributing humanitarian aid. In more simple words, what we really did is that initially at the first phase of the empowered aid study, we conducted participatory action research with refugee women and girls and asked them questions about their own lives that helped identify the SCA risks throughout the process of humanitarian aid. And then we also asked them to provide us with a list of recommendations that they feel aid actors should implement to make distribution safer for them to access. And then we conducted a participatory activity to prioritize this set of recommendations. This was done through participatory interviews, group discussions, of course, after always obtaining consent before every activity to ensure the empowerment and voluntary participation. And this was not just done with women and girls, but we also conducted interviews and group discussions with members of the host community as well as key informants. And after we collected this data, we really wanted to test it out. So here we then used implementation science, which means we worked with local and international organizations and their existing distribution programming to really pilot test these recommendations that the women and girls provided us on ways to make aid safer, to test them out by adapting the aid distribution modality. We worked with partners such as CARE, World Vision, IRC, as well as local partner in Lebanon called URDA, to really adapt the way, their existing post-distribution monitoring tools so that we can capture women and girls' perceptions of risk and safety in relation to the various stages of aid distribution, and which, as a result, developed our EA, our Empowered Aid Meal Toolkit, which you can see to the right, and you can also access through our website. Here, our focus was really like to demonstrate how to put the women and girls recommendations that we captured from the research phase to put it into action. And we aim to show their feasibility in humanitarian settings and show how small changes can make existing M&E tools more fit for purpose to reduce these SCA risks. The full set of findings from each of the countries we've conducted research in can be found on our website in addition to a package of policy briefs for each country that include an overall brief summarizing the results and also sector specific briefs that tailor the findings and recommendations to each type of aid, such as cash, wash, fuel and firewood, food, and shelter assistance. And also all the toolkits and the facilitation guides that we use are also all available on our website. So you can all access, and this is like sourced openly for anyone to access. And go, thank you. And meanwhile, please, if you have any questions about anything I'm saying, please don't forget to put that in the Q&A. So here, let's talk a little bit about participatory SCA risk mitigation. So when we think about that, one way that Empowered Aid contributed to it is by challenging us to go beyond a one-time participatory method, but rather going back to the communities, for example, we held interviews with or focus group discussions with at the beginning of the project, really to share with them what's being done and how what they shared with us is being used, such as the recommendations being applied to a distribution. And really, this is where trust is built, like when they see their words are put into action. With Empowered Aid, what we're really thinking about is how to include these affected individuals, especially women and girls, in program design and delivery, in monitoring and evaluation, and how to do that over time. So really, we want to engage with them not only as an at-risk population, but as well as knowledge holders. The other piece we really focus on is the M&E tools. So a lot of the M&E tools are designed to measure the quality and quantity of aid delivered, but not the SCA risks that are associated with that. We're not really asking people to start using a lot of new tools, but rather just adapt the existing ones or add additional questions so that they can better monitor the ongoing SCA risks associated with their aid delivery processes, feeling of safety and risk by aid recipients, and also monitor the types of recommendations that are important to address these risks. For example, how many female aid workers are present or the availability of awareness-raising material. Why we center around women and girls? Because research has shown that globally, women and girls are the groups disproportionately at risk of SCA due to the structural and systemic gender equality and discrimination. And we also recognize that they are the experts in contextual safeguarding and play a leading role in ending GBV and SCA. A deeper dive a little bit into what tools we use. So also when we are expanding to different countries, this is our contextualization toolkit that we have piloted, field tested, and revised over 6 settings, such as Lebanon, Uganda, Bangladesh, Kenya, Jordan, and Turkey. The main idea behind this toolkit is to use Empowered Aid approaches in your own context to make sure the risks and recommendations identified in the countries we've already worked in are being addressed in the specific, in your local specific context and situation. This is going to be released later this year, and it has the following components, such as the facilitation guide and PowerPoint. There's a note-taking booklet for the participants and templates for them to use when they are applying it. There's a supporting material and illustrations to use, as well as a TOT to build the capacity of different staff to be able to facilitate this process. And lastly, this is just an example of the toolkit and how different levels and different sectors are able to use this toolkit, whether they want to use all 3 sections or just use one of the sections. This is tailored specifically to how each partner wants the content and the length of the workshop to train people to use this toolkit to be. So this is more like a detailed overview of how to use the toolkit. And in summary, this is the main things I wanted to highlight, so that participatory SCA research mitigation emphasizes why we need to engage affected population with particular attention to women and girls in all their diversity to identify contextually relevant risks of SCA and mitigation measures. Empowered Aid, we offer a lot of resources and tools all accessible on our website based on rigorous participatory research in 2 countries, as well as field testing and revision of tools in the other 6 countries. The toolkit, which I was just talking about, is one of these resources I'm talking about and provides a step-by-step guidance on how to engage the communities in identifying SCA risks and accounting for them in the design as well as the monitoring of aid programs. And by using participatory methods to assess and mitigate SCA risks, aid actors both are addressing and underlying the power imbalances that fuel such risks and recognizing and benefiting from the knowledge that women, girls, and other affected people hold. Thank you. So this is what I had to say. This is regarding, I know it was a bit general about empowered aid, and I know the contextualization toolkit. If anyone has any detailed question about that or any question you would like, please pose in the Q&A. And we have time left at the end of the webinar to go over the questions, and hopefully we'll be able to address that by then. Now it is I'm going to present one of my dear colleagues who I've worked with when we were implementing empowered aid in Jordan, Maha Al-Saudi, who is the Child Protection and Safeguarding Officer within the World Vision Syria response in Jordan. She has over 5 years of experience in the field, and Maha has honed her experience in addressing issues related to child protection, safeguarding, and gender equality. Prior to her current role, Maha served as the Empowered Aid Project Officer, where she collaborated with Syrian refugees to address and prevent SCA. Alongside her professional accomplishments, Maha is currently pursuing a master's in children and young people's mental health at the University of Edinburgh. Maha, it's very nice to have you here. And we're really excited to hear what you have to say about the work that the Global Women's Institute and World Vision Syria response when we applied Empowered Aid's participatory research findings on mitigating SCA risks in Lebanon and Uganda to other countries within those regions, as well as in other regions. This was done through a process of understanding which findings were relevant in that context and which were not. Could you please share with us how this contextualization process, as we call it, in Jordan was used to identify SCA risks in Jordan and how to address them? Over to you.
Thank you so much, Loujine, for your question. Hi, everyone. Good morning, good afternoon. So I'll start by giving a quick brief about Jordan and the location where Empowered Aid was implemented. So Empowered Aid was implemented in Al-Azraq camp. This camp was established in 1914 in response to the influx of Syrian refugees. It's operated by the UNHCR and government of Jordan. It has 6 villages. And today, Al-Azraq camp is home to around 40,000 Syrian refugees and is the 2nd largest camp in Jordan. Distances in the camp are large, and the camp stretches for around 15 kilometers. Regarding life there, Syrian refugees live in caravans, as you can see in the picture. There are no taxis, buses, cars, and the only means of transportation are bicycle, mainly driven by males inside the camp. Next slide, please. So Empowered Aid began operating in Jordan in September 2022 to scale up the intervention arising from completed research in Uganda and Lebanon toward Vision Syria response in Jordan. So as a starting point, we conducted the conceptualization process. And the aim here was that we needed to identify the sexual exploitation and abuse risks that exist in the camp and how to mitigate them. What we did here in this process is that we conducted separate workshops with Syrian women and girls, and also participatory group discussions with men and boys to conceptualize Empowered Aid findings in Al-Azraq camp context. The key point here was to engage Syrian refugees themselves in the process, as they are the safeguarding expert, they live there, they know better. And actually that helped us to identify the sexual exploitation and abuse risks and solutions that 100% reflect local realities and priorities. We conducted 2 conceptualization workshops. One was with women and one with girls, and also 8 participatory group discussions, 4 with men and 4 with boys. In terms of numbers, the total number of refugees participated in this process was 74, 15 women, 19 girls, 20 men, and 20 boys. And the participants were voluntarily selected from villages where World Vision Syria Response operates. We conducted like phone calls, home visits to recruit the participants. And also the team made sure like to explain the aim of the workshop, the time, and we collected, of course, informed consent from all participants and also from caregivers of minors. So now moving to the structure of the conceptualization workshop. Can you like just go back to the previous slide, please? Yeah. So the conceptualization process and like how we implemented that. So for women and girls, we use the Empowered Aid Conceptualization Manual. Each workshop lasted for 3 full days. We covered different topics each day. For example, on the first day, we focused on learning about core concepts of gender, gender-based violence, sexual exploitation and abuse, and like what's the difference between them. The goal here was to make sure that the participants were aware of the workshop goal and the terminologies that we're gonna use. Also, of course, to build the trust and to prepare them to discuss sensitive topics like GBV and SIA. On the second day, we identified the SIA risks they face in the camp. And here we conceptualized the Uganda and Lebanon research findings. And we discussed with the participant what type of SIA risks are relevant to the camp, what are not, and if not, what other type of SIA risks that are unique to Al-Azraq camp context. So to do that, here we used different participatory tools like tree diagram, community mapping, open-ended stories, reflection exercises, and group work. For instance, the picture you can see in the slide shows the community mapping exercise. Here we divided the participants into small groups and asked them to draw the camp, highlighting the places they visit regularly, and then identify the safe versus unsafe places with specifying the type of GBV or SIA risk they encounter at the unsafe places. For the third day, we identified conceptually relevant recommendations to mitigate the risk of SIA. And also here we shared the mitigation measures that was implemented in Uganda and Lebanon and asked the participant to select the most relevant solutions or also suggest the new solutions for like any newly identified risk that was like unique to the camp. On the other hand, for the participatory group discussions with men and boys, we use the Empowered Aid participatory group discussion tool, which focuses on SIA risk and also include 2 main exercises, the free listing and open-ended stories. Each focus group lasted for about 15 minutes, which we heard from men and boys, like we heard like their perspective on GBV and SIA risk in Al-Azraq camp. Next slide, please. So moving to the main findings, women and girls in Azraq camp face like different GBV and SIA risks, either at the point of distribution or service, when traveling to access services, during home visits, and also when traveling to fulfill their basic needs. Even though like actually both women and girls experience relatively similar risks, adolescent girls aged 15 to 18 years were identified as most vulnerable population affected by GBV or SIA. And verbal harassment actually was found to be the most common type of GBV the adolescent girls face, either around schools, when traveling to access like NGO services, or when moving to or from any place in Azraq camp. Unfortunately, some girls are actually deprived of NGO services due to these risks, while others have completely dropped out of school. So based on these findings, adolescent girls were given higher attention, higher priority when implemented the recommendations. And this was actually also communicated by the participants themselves. They all agreed that adolescent girls are the most vulnerable. So after we identified solution for like every Syria risk that we identified, we wanted to know the Syrian refugees' priorities in order to know or to decide what to focus on in the project. So for example, in the picture, it shows like how we selected the recommendations. Like we printed the Uganda and Lebanon recommendations and also asked the participant to draw a picture for newly identified ones. There were around 20 recommendations at this level. So we conducted a voting exercise where each participant selected their top 3 recommendations. Next slide, please. So for the applied recommendations, what we did is like sessions for community sensitization to GBV and SIA, and better knowledge and communication on SIA complaint and reporting mechanisms, formal, informal accompanying systems when girls travel to receive World Vision activities, and information sharing on moving in groups, and also ensure the presence of female and male outreach staff when conducting home visits to girls' shelters. The picture actually shows how the girls started moving in groups toward vision facilities instead of going alone. And here I can share also a quote shared by an adolescent girl. "I feel way more empowered after moving in groups. I feel safe now. I wish other NGOs can do the same thing." Next slide, please. So at the end, I'm happy to share with you our latest publication with the amazing Global Women Institute team, Elena, Loujine, Mathilde, and Jessie. The study discusses how we created accompanying system to improve adolescent girls and women access to services. And that was shared on a UK journal called Child Protection and Practice. So make sure to check it out for more details on empowered aid and applied recommendations in Jordan. Thank you.
Thank you so much, Maha. It was very interesting to have a summary of all of the work that we've done together in Jordan and look at the great results that has developed so far, and the feeling of women and girls like being more empowered and more safe to access the Peace Center. Like, this is really great. Thank you so much. We're gonna move on to our next panelist, which is Mariska. Mariska, yes. So Mariska is leading a project focused on managing risks of SCA with a team based in Switzerland, Mozambique, the Philippines, and soon in Turkey. The project created the Interagency Risk Assessment Toolkit to help interagency PSCA networks conduct thorough risk assessments with a focus on including community perspectives. Welcome, Mariska. It's very nice to have you with us. Recently, we know IOM developed the Interagency Risk Assessment Toolkit building on the SCA Risk Overview Index. Could you share with us what was the process of developing it, and how it has been used so far, and how is this toolkit supporting PSCA networks?
Thank you so much. I hope you can hear me loud and clear. If not, feel free to raise your hand. It's wonderful to see everyone and to be part of this panel. I feel really honored. So my name is Mariska de Keersmaecker. We wanted to introduce to you the Interagency Risk Assessment Toolkit, IARA for short. So I'll be saying IARA throughout the presentation. So what I mean is Interagency Risk Assessment. So interagency risk assessments, IARAs, they're actually nothing new. They were already being implemented across the globe by PSCA networks, but it was always conducted in a different way. And a lot of the time, there was a lot of time going into it because there was no standardized methodology to actually conduct the IARAs. So IOM actually released a technical note on joint risk assessments in 2021. And so this toolkit builds on the work that was done already in the guidance note. So the toolkit is really for PSA networks at the interagency level. And the methodology is now publicly available for PSA networks to conduct IRAs themselves and to create countrywide or region-wide SEA risk registers. So the risk register is really the product, what you want to come out with out of the IRA. And what it provides you is an overview of SEA risks and targeted recommendations for key stakeholders in country to strengthen the PSA response. And so the aim is really to integrate those recommendations into existing work plans, strategies, and to open up also the conversation at the interagency level about SEA risks. The IARA toolkit is for humanitarian and development contexts, and it's very much an interagency approach. So if a PSA network, let's say, wants to start using it tomorrow, the IOM logo doesn't need to be featured on the product. It's really an interagency deliverable. Next slide, please. So the pilot project ran last year in 2023 in Mozambique and the Philippines to conduct the IARAs with the PSA networks at the country level. And so based on the piloting at country level as well as global consultations, the toolkit was created. And so now we're increasingly working with different networks to start implementing the methodology and provide more support. Next slide, please. So what are we measuring? So the 4 risk dimensions that you see on the slide are aligned with the global SEA risk overview index for complementarity. But so all in all, we really look at what are the SEA risks, what are community vulnerabilities, harmful practices, and on the other hand, we're looking at what systems, what PSA systems have we put in place and how well do they work? So are our staff and partners understanding PSA? How well is PSA mainstreamed within our programs, for example? We can go to the next slide. And this slide really shows the 6 stages of the process that normally a PSA network would go through in an IARA. Every step in the toolkit has different tools, including presentations, workshop outlines, data collection tools, even, to the nitty-gritty emails to be sent out to senior leadership to convince them of the importance of the initiative. So check it out. 2 key messages, maybe 3, about the methodology. It's super important that we first look at all the information that is already available at the country level and that is already collected. So all of the work, the presentation that you just saw on the Empowered Aid Contextualization Toolkit, if that is already carried out in your context, the PSA network can very much build on the consultations with communities that were already done by other actors. Equally, all of the information that we get from the global SEA risk overview index, that can all be used as part of this process and should really be used. Only as the 3rd step, after seeing what you already have, there is the option of collecting more additional information if that's needed. The second point on the methodology is that it's really important, and this is in line actually with also the Empowered Aid approach, community voices, they must be included in the process. So if no information is available on community consultations on SEA risks, we very much encourage networks to collect that through their member organizations. And finally, we, as part of this process, we envision this to happen for humanitarian context approximately every 3 years. For development contexts, it would be every 5 years, just so we ensure that the risks that we identify, they are updated and evaluated on a regular basis. On the next slide, we just highlighted some of the tools that are specifically on data collection as part of the toolkit. But remember, you don't have to use all of these if you already have some information available. But just they are there in case you need it. And it gives you an idea. I wanted to show you the slide also because it gives you an idea which actors that we're actually trying to talk to at country level when we do an interagency risk assessment. So it goes from senior leadership to communities, to focal points, to program managers, but also the different clusters. Ideally, child protection, AAP, all of the templates are there in case needed. I wanted to give you an example of what an SEA risk register could actually look like. And so wanted to start maybe with the piece of Mozambique with the risk IRA that we did for Mozambique and the SEA risk register that came out of that. So quite an important risk or prevalent risk that came out was related to community leaders. So in Mozambique, community leaders are government actors with substantial power and influence within the community. So they are really tracking population movement in the emergencies and doing some of the beneficiary registration, which then informs the selection process for beneficiary selection done by organizations. So because of this power, government actors and community leaders, they do have influence on who is on the list and who is not. And this leads to some abuses of power and risks of SEA. In Mozambique, however, there are three really exciting and promising developments related to government response to SEA. So the Mozambican government, they established a specific unit to address PSEA, and the government is quite open to discuss PSEA with the network. So that's good. The second of all, the government has recently endorsed a government code of conduct where they are specifically identifying community leaders as humanitarian actors. So this is a huge achievement there of the PSEA network. And then the third one is that SEA is actually also punishable by the Mozambican laws. Another outcome of the risk register is that as PSEA is not sufficiently mainstreamed into programs. And the third one is on child-sensitive PSEA programming. So from the focus group discussions with communities, adolescent girls came out as the most vulnerable to SEA, especially those aged 13 to 14 who are prematurely considered women due to initiation rights in the communities. They are particularly vulnerable to SEA. So wanted to just give these three short examples to show you what it can outline an SEA risk register, just to say that it doesn't only look at SEA risks, but it also outlines some promising practices on how to mitigate risks in the recommendations. If we go to the next slide, one of the issues in our project that we encountered was we didn't really know what PSEA mainstreaming really meant. There was no global definition and no global standard on how to mainstream PSEA into programming. So what we came up with is this acronym, the Transform, and we created a Transform marker with all of the elements that you see on the slide to measure how well programs are mainstreaming PSEA. We're super proud of it. We are piloting the Transform more and more to understand really the level of PSEA mainstreaming into programs. And if PSEA is not mainstream into programs, that is an SEA risk in and of itself. That concludes really the presentation. We have included the contact information of the project in case you are looking at this and are like, okay, we're maybe interested in our PSEA network to do the IRA. Do not hesitate to reach out also if you have any questions, and thank you so much.
Sorry, I was on mute. Thank you so much, Mariska. Thank you so much for your presentation. Really, this is a very interesting toolkit. I personally can't wait to really dig deeper into it and know more about it. So thank you for sharing that. Last but not least, we're gonna move to our third panelist today, which is Kate. Kate, welcome. Kate brings
Thank you so
15
much,
years
Joey.
experience. So Kate brings 15 years of humanitarian and development work experience in the Middle East and Europe contexts with extensive expertise on program designs and quality assurance, mainstreaming gender equity and social inclusion, as well as humanitarian protection and safeguarding. In her current capacity as a regional strategy and ministry quality director for World Vision Middle East and Eastern Europe, Kate supports 11 field offices in strategy design and measurement, program quality, multi-country research, and impact reporting. Kate is also a PhD candidate finalizing research on gender drivers of adolescent civic engagement in the country of Georgia. Hi again, Kate. We've worked with World Vision in several countries for several years now, and we know that World Vision has demonstrated a learning mindset and encouraged uptake of empowered aid tools and approaches within its Lebanon and Syrian responses. From a regional perspective, what has been the experience of World Vision applying empowered aid within its programming in Lebanon and in Jordan? And what are some of the key actions or areas that World Vision team considers crucial for scaling up empowered aid?
Thank you so much, Loujine. It's a really great honor to be with you today. 5 years ago, I wouldn't even imagine to be in the Global Women's Institute panel, and I'm really grateful. So I sit at the kind of leadership level in a way, and so my reflection will be a bit more generic, but also hopefully strategic enough for our listeners. But as somebody that comes from safeguarding background, I often honestly wondered why PSCA cannot be sufficiently covered by organizational policies like safeguarding, Jesse. After all, we are the organization that puts safeguarding at the heart of everything we do. We do rigorous annual reporting on safeguarding policy implementation. We do annual awareness raising campaigns to ensure that safeguarding is part of our culture and identity. So why do we need a separate methodology? So that was my question probably 2 years ago. But in the last 2 years, we were really fortunate to implement empowered aid in 2 of our offices, in Syria response and in Lebanon. And both offices did a wonderful job, and we have so many lessons learned. So first and foremost, I think we have to emphasize that empowered aid practically and meaningfully teaches us how to integrate safeguarding principles and standards in the project design, but also implementation and monitoring, so that we can actually address do no harm concerns, also protect our project participants, and even increase the quality of project outcomes as a result. So we call it impact. So as a result, after analyzing safeguarding practices integration on my own a little bit more, I had the realization that from the policy perspective, our safeguarding policy mainly focuses on the incident reporting and response and provides very practical tools on how to do that. And somehow the prevention part, which is also mandate, falls through the cracks. And this is exactly where empowered aid comes in and fills this critical gap, I would say. Another lesson for us was that we have realized that how relevant and applicable one empowered aid findings can be within the sector or even between different sectors. So in other words, once we apply empowered aid for a specific project, most of the findings and recommendations and contextualization details can be and even should be easily used for other projects within the similar, which has the similar implementation pathway. For example, I will bring World Vision Lebanon's example because Maha was speaking on Syria response. So for World Vision Lebanon specifically, they implemented empowered aid for WASH project 2 years ago. And since then, they were able to apply the findings and recommendations to other WASH projects, not only to one specific, but to other WASH projects that they are implementing, and also to do some application to other sectors, such as education. And of course, this was done through updating distribution SOPs, standard operating procedures, including PSEA capacity building lines for the frontline staff, and as well as for the partners in all the projects, and so on. So doing one comprehensive risk assessment and recommendation contextualization can actually inform several sectors and can be used for multiple projects designs moving forward. So it's not just one-time exercise, which is beauty, because you can use those findings and recommendations to similar projects at least for a year or more after that. And thirdly, we learned that Empowered Aid is a kind of perfect meeting point of safeguarding, a participatory meal, and GESI, gender equality and social inclusion. And we should not undermine how rewarding and even transformational Empowered Aid can be for project participants through the implementation process itself. And we have collected in each context testimonies of very positive impact from project participants, because they finally felt heard and they felt understood, which means so much for their mental health and for the sense of hope, etc. To move to the second question very briefly, because I'm sure we want to have time for Q&A. As much as we are committed to scale up Empowered Aid among all 11 field offices, 10 offices who has currently response interventions in the Middle East and Eastern Europe, in full honesty, I think we have the biggest task still ahead of us. And it's twofold, as I see it, at least from where I stand. In the short term, we need to understand how to sufficiently fund comprehensive country-level risk assessments and contextualization processes, so that we inform project designs of various sectors, not only WASH or not only education per se, but every sector that field office is operating. And also, we need to further build evidence on the importance of putting SEA as prevention at the center of every humanitarian intervention. We've done great session last year at Women Deliver, where we presented and held a session about World Vision Lebanon's findings on Empowered Aid implementation. So keep talking and speaking and building evidence about it is critically important, because there is so much advocacy that still needs to be done. And on the fundraising side, I'm very happy to see ongoing effort from several field offices in our region to build proposals and to fundraise for the Empowered Aid scale up. And I'm sure we will continue and focus on that in the future. But however, in the long term, I think we need to advocate internally or on embedding SEA prevention tools into organizational policies and guidelines, like same as Mariska was presenting from the kind of donor perspective. As an implementer, this is especially important for us, for the grassroots organizations. And unless those preventive measures become a must of every project design and organizational accountability at large, especially from budgeting perspective, because we might have a beautiful guideline, but if we don't have a space to budget for it and also to from donor perspective space to have approval on those costs, then we will keep focusing on reporting and the response side of ACA incidents rather than prevention, which, as we all understand now, only partially fixes the complex issue of sexual exploitation and abuse. And I do believe also from the subjective point of view, to be honest, that mandating PSCA is a must in all contexts, not only in humanitarian context. And hopefully there will be, I mean, as an organization, we will definitely look into that because it's relevant for humanitarian nexus as well as development. So in summary, for us as a World Vision, this is really just the beginning, and we have a long road to go. And evidence-based tools such as Empowered Aid is definitely a perfect start. Thank you.
Thank you so much, Kate. And definitely our work has been really empowered because we've done that together, and we've worked with all organizations which were very empowering, such as World Vision. So we're really happy we had the chance to do that together in different areas and in different locations. So thank you for that, and thank you for your inputs in answering the question. Since we are done with the panelists' presentations, we're gonna jump over to the Q&A. Before we begin, as a reminder, anyone who has any questions to any of the panelists, including myself, as anyone else from from the Global Women's Institute team, as well as Kate, Mariska, and Maha, please feel free to ask the question in the Q&A tab. My first question I can see in the Q&A is addressed to you, Maha. And they are thanking you for the detailed overview of the participatory empowered aid contextualization that was done in World Vision. And they are curious to know how many of the final recommendations were added by the participants from Azra camp. This question was from Rida.
Thank you, Rida, for your question. So regarding the recommendation, we first started with 15 recommendations that was applied in Uganda and Lebanon. That was the recommendation that were applied there. So we started from here in order to see how to conceptualize them and if we need also to identify new ones. So according to this process, we categorize the recommendations into 4 categories. Some of the questions, the recommendations that we found that, yes, this need to be applied here. The other category are like things that were applied to Uganda and Lebanon, but we need to adapt it, to change it a little bit in order to fit the Jordan context. The third category was recommendations that were applied in Uganda and Lebanon, but we don't have to apply it in Jordan because it's already applied, it's already used either by us or other NGOs, so it's already applied. We don't have to do any changes to it. And finally, the newly identified recommendations that were not maybe discussed in Uganda and Lebanon, and that was unique to the Jordan context. So for women, they identified about 5 new recommendations. And for the girls, they identified 4 new recommendations. For the men and boys, most of the recommendations that they said was things that already, discussed in Uganda and Lebanon. So it was like things that we maybe we take it as or we adapted as. But the newly identified one was like 5 for women and 4 for girls. And I can give you an example for the, the recommendation that was like newly identified by the girls is that they needed us to see if we can increase the shifts, the school shift, because we have we have like 1 school in each village in the camp. And the morning is like for girls, the evenings for like boys. So they needed us to see if we can push in order to increase the shifts, because actually one of the risks that some boys come early to the schools in order to see the girls, and all the verbal harassment. So that was thing that was not applied to Uganda and Lebanon, but was unique in Jordan. I hope that I answered your question.
Thank you, Maha. I also remember that one of the main activities that we conducted with women and girls to determine which of the recommendations we're going to apply to the distribution or to the way they access the service, specifically in Jordan, which was the Peace Center, we conducted a prioritization exercise which was a very participatory activity in which they prioritized which of all of the recommendations that they provided were a priority and it needed to be implemented in Jordan. So just adding that real quickly. I see we have questions for Mariska. So Mariska, there's a few questions on the IRA. So they're asking, does the IRA connect with the CRO developed by the interagency, and can IOM share a brief on the Transform PSCA mainstreaming resource? And is there a model of questionnaire for communities or interview concerning IRA SCA?
Many questions at one way. Yes, the IARA is fully aligned with the global framework that was created by the ISC, so the Global Zero Index. The IARA is fully aligned with that because of complementarity, and we wanted to build off the IARA from the results of the global index. So that was the first one. There are focus group discussion templates and key informant interview templates in the toolkit that you can just download, use, adapt to your context, and use to do SCA risk data collection. And what was the third question, Loujine?
Yeah, so it was, is there any model of questionnaire for communities or interview concerning IRSCA? Is there a model of questionnaire for that?
Yes, so there are the tools, the models are in the toolkit. And you also asked for the transform. The
Yes.
transform marker, we would love for people to start using it. It's also part of the toolkit. It's a very, very simple scoring system that projects or program managers can use to score themselves on each of the transform elements to see if how they're doing on PSEA mainstreaming. Yeah.
Okay, thank you so much, Mariska.
You're welcome.
Kate, we have questions directed to you. It's from Adriana. Adriana is asking about the visual that you were sharing when you were presenting. And she was asking if that is something that other organizations can use. Maybe either you or Maha could provide a little bit of background about this visual.
I think Maha is in much better position to speak about it.
Yes, just a brief background on this visual, Maha, please.
Yeah, so this visual is one of the actually under the first recommendation that we applied, which that we want to disseminate PSCA messages in the Azraq camp. We did that through paintings, WhatsApp messages, and posters. So the picture you're seeing now was like we like around, I guess, 15 adolescent girls helped us to draw this paintings. And it's actually located in our World Vision centers, and it represents the PSCA, and it has a quote with like "Stop Sexual Violence." So we actually also did another one in English, and we did also another painting in the front of the school. So it was literally at the school door. We painted a picture that says also "Stop Sexual Violence," and we allowed girls to write quotes about that. So they like put like quotes like "Be strong, don't be silent, let's all stop like sexual violence." So it was like really interesting, and actually the girls till today speak about how amazing and how empowered they felt when they draw these paintings. And I guess, of course, you can use the pictures, and the one is showing. I guess it's included in one of our reports that you can find in Empowered Aid website in the annex section. So, or maybe if we can also share it with you.
Thank you, Maha. Thank you so much. We're gonna have to have one more final question before we wrap it up, which is from Murad from Afghanistan. Murad is asking if there's any examples that the government and local authorities reacting negatively toward the contextualization of SCA programming, and how was it addressed? Who would like to answer that? If anyone had an experience with that, of course.
I can jump in on that. So as part of the interagency risk assessments, it's very important to do a lot of engagement with governments about this issue. So it's actually a core component. But we've noticed that in some countries, governments are more willing to speak about this issue, first of all, and are more also willing to see some of the recommendations, specifically on PSEA. And it's quite difficult sometimes to effectively when you start doing the reporting of the SEA risk register to actually talk about some of the risks related to government actors and local authorities. So we do, if you have issues with that, we do have some lessons to share of how to really make the language appropriate and acceptable to government actors, because it's really an art, I have to say what you have to say, but to do it in a way that is very that is fit for purpose and that is acceptable to government actors, which is super important.
Thank you so much, Mariska, and thank you for sharing your email in the chat for anyone who had further questions. I know we had a lot of questions that we were not able to answer, but as I said, Mariska had shared her email in the chat. So if you want to ask any questions directed towards her, or you can also send all of your questions to our email, empoweredaid@gmail.com. And you can contact us there for all of your inquiries. Just a quick recap. So all of our findings, tools, and guides are available on the Global Women's Institute website and the Empowered Aid website, including briefs designed for policy and advocacy and guidance documents to support others to use these participatory SEA risk mitigation measures in the humanitarian settings. And also, my colleague Hope will be sharing a survey in the chat box to capture your feedback about this webinar. So please, we would love to hear your feedback on that. So please make sure to fill it out if you get the chance. And last but not least, I want to thank all of the panelists, Maha, Kate, and Mariska, as well as my colleagues from the Global Women's Institute team and the Empowered Aid team, Elena, Jessie, Hope, and Amal, for really making all of this work and making us have this fruitful discussion and really empower and learn from each other more and more. So thank you so much. We do have our third webinar taking place on June 6th, which is about adapting MNE tools to monitor SEA risks in program with Mercy, Atom, Shuruk, Kutesh, Nigusu, Zilkel, and this is going to be moderated by my colleague Hope Harriet, which is also the Empowered Aid consultant. So please make sure to register at the link in the flyer if you are interested to attend. And again, thank you all so much for joining, and we hope you benefited from this webinar. So thank you so much.